Good afternoon or good morning, depending on where you're coming from, to all who are joining us and some still logging in. Um, if you've come to join the RAN webinar focused on veteran needs, well-being, and data to inform policy and prevention, you're in the right place. Um, what I'd like to do is welcome everyone to the first of this six-part RAN series, where we'll get a chance to hear from some experts that I'll introduce very shortly after a few words. Next slide. For those that don't know me that are joining, my name is Don Harris. I serve as Senior Project Associate and Assistant Director with SAMHSA's SMVF TA Center, and I'll serve as moderator for this panel. So in the background, I'll be monitoring some of the questions or comments or thoughts that folks are posing on the platform so that they can be addressed as best we can before we close out today. Next slide. Before we continue on, I just need to share that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, and policies of SAMHSA and the U.S. Department of Health and Human Services, along with RAND. Next slide. Since 2008, SAMHSA has partnered with states and territories to strengthen behavioral health systems serving SMVF, service members, veterans, and their families, and providing technical assistance through its SMVF TA Center. SAMHSA leads the public health and service delivery efforts that treat mental illness, especially serious mental illness, prevent substance abuse and addiction, and provide treatments and supports to foster recovery while ensuring access and better outcomes for all. Next slide. Just a little about the SMVF TA Center for folks who may not be familiar. The TA Center serves as a national resource for states, territories, counties, and communities to help strengthen the capacity to address the behavioral health needs of military and veteran families. We do this in a few ways. We help to monitor evolving trends that specifically relate to these populations. We provide technical assistance, training, and tools, along with consultation to teams across the country. We identify and share some of those promising best and evidence-based practices that exist, identify experts and resources such as those you'll get a chance to hear from today. We support the planning and implementation of state and territory interagency teams and their planning, and we support the training of SAMHSA stakeholders and grantees. Next slide. And all of these efforts are implemented in a variety of ways, ranging from policy and implementation academies through crisis intercept mapping, webinars, learning communities, et cetera. So there are a number of ways that the SMVF TA Center partners with communities and engages and supports the sharing of that knowledge and information. Next slide. Both of our presenters today, and actually presenters for this entire webinar series, are both coming from RAND. For those who aren't familiar, RAND is a nonprofit, nonpartisan research organization that helps to improve policy and decision making. We've partnered closely with RAND over the past few years to help support the implementation of goals for states, territories, and communities. RAND's goals overall are to conduct rigorous evidence-based research, provide data-driven policy recommendations, support federal, state, and local decision makers, and then work across sectors including health, national security, education, veterans policy, and social services. And like I said, RAND has collaborated with the SMVF TA Center since 2017 to support these TA efforts. Next slide. All right, so looking at today's learning objectives for this webinar, they are fourfold. We're looking to describe how veterans' needs and well-being vary across states and why state-level data matters. We hope to interpret population representative data to inform policy, program design, and prevention efforts, identify key veteran data sources and understand their strengths and limitations, and then understand how to apply data-informed insights to support transition planning and suicide prevention initiatives. Next slide. So our presenters today, as I suggested, both come from RAND. Our first presenter will be Dr. James Murphy, a behavioral and social scientist with RAND. And following his presentation, we'll get a chance to hear from Dr. Claire O'Hanlon, who serves both as a policy researcher at RAND and also as a professor of policy analysis at RAND School of Public Policy. Next slide. All right. So before I turn it over to Dr. Murphy, I just want to talk a little bit about his background. So Dr. Murphy, as I suggested, is a behavioral and social scientist at RAND. His research focuses on health and well-being of individuals and communities, including military personnel and families. Some of Dr. Murphy's work deals with applying quantitative methods to complex policy challenges related to social determinants of health, social support networks, criminal justice, and military health. And his work has been featured in leading journals such as the American Journal of Public Health and the American Journal of Preventive Medicine. And his work also helps to inform policymakers and practitioners to strengthen those systems that we discussed before. So at this point, I will turn it over to you, Dr. Murphy.
Thank you very much. Yes. So I think we're on to the next slide now. There we go. Thank you all for the invitation to present today. So I'll be discussing a new report slash tool, which RAND released a couple of 2 or 3 weeks ago. That includes state level measures of veterans' well-being and the needs of veterans. It's authored by myself and my co-author Terry Schell. Next slide, please. So this work was funded internally by RAND's Veterans Policy Research Institute, which is an internal resource we have at RAND that supports this type of work. Please, next slide. So I'll dwell here for a moment. If anyone can't really wait to dive in while I'm talking, you can access the report through the QR code or through the URL that is at the bottom of the screen. And I think is going into the chat. There we go. Thank you, Chantel. I'll flash the slide up again at the end for a second chance if anybody would like to take a look. Next slide, please. So to outline today's talk, I'll begin by outlining the motivation and goals for creating this tool. Then I'll walk through the data and methods we use to create it. So my understanding is this is a data-hungry audience, so I'll also talk a little bit about our reasoning in choosing the sources we chose to use for this. Then I will walk through the elements of the data sheet we produce for each state. We do one sheet for each state and the District of Columbia. We'll conclude by discussing the limitations of the tool. There's no concrete plans right now, unfortunately, for funding or expanding this work, but we at RAND are very excited about it. So I'll discuss a bit about the places we would like to take it should the opportunity emerge to continue the work with developing these types of data sheets for these types of dashboards, really, for states to have a sense of what their veterans populations are like at any given moment. Next slide, please. So why the need for state level summaries of veteran needs and well-being? First, it's plausible, and indeed our work shows, that the needs of veterans may vary significantly across states. And secondly, much resources allocation and service delivery occurs at the state level or at the local level, both by governmental and nonprofit organizations. However, the kind of state level and local level this kind of state level and local level decision making faces an information gap because most research about veterans at either the national level occurs at the national level or involves case studies about single states without cross-state comparison. Data that's readily accessible includes veterans that you currently utilize VA services, but not the broader local veteran population. And it's very expensive to undertake original data collection that would let states assess the needs of the broader veteran population, not just those that are currently accessing VA services. Next slide, please. So what we do in this tool is we take publicly available data sources that already exist and generate state-level summaries about the veteran populations in each state and the District of Columbia to begin to fill these knowledge gaps. We hope that these state-level insights will allow state and local governments and nonprofits to tailor services and resources to meet their local veterans' needs. Next slide, please. So I'm now going to transition to how we constructed the summaries and then walk through a little bit of how to interpret them when you're actually like looking at the pages. Next slide, please. So we selected 11 measures of need or well-being across a few different domains. Most of these are based on surveys, are based on social survey data. The only one that comes from administrative data is veteran level suicide rate. So what we've taken here is a few different measures. The first is a self-rated general health that in the academic literature has consistently found helps predict future health outcomes for individuals. For mental health, we use two measures. First is a survey-based report of the number of days in the past month a veteran reported having bad mental health. We also include the veteran suicide rate for the state. Then we have a measure of daily smoking and binge drinking, as well as obesity. The final health measure we include is the percentage of the state's veteran population that has a VA-issued service-connected disability rating. Finally, in the socioeconomic realm, we include measures of unemployment, low family income. Here it's defined as 200% of the federal poverty level or lower. Housing cost burden, defined as spending more than 30% of your household income on housing expenses. And the percent of veterans who do not have a bachelor's degree in that state. Next slide, please. So where do our measures come from? So as I said, these are predominantly survey-based. They're drawn from surveys of the general population, veterans and non-veterans combined. So that's what allows us to get beyond the limits of VA administrative data, which only includes those veterans who are using VA services. We used individual level data from what's called the Behavioral Risk Factor Surveillance Survey, BRFIS for short, conducted annually by the Centers for Disease Control and Prevention. To get a good sample size for all states in BRFIS, we combined the 3 most recent years of data that are available, 2022 to 2024. Combining those 3 years, we got a total of approximately 154,000 veterans. We used data from the 2023 American Community Survey, which at the time of analysis was the most recently available. 2024 has since been released. ACS is a larger sample than BRFIS, so we didn't feel the need to combine multiple years. 2023 ACS included over 190,000 veterans. We analyzed ACS and BRFIS ourselves. Those are our original calculations. We drew on VA published reports to produce the demographic information and the suicide rates that are also on the sheets. Next slide, please. Okay. In this report, each state has a 1-page summary of each of the measures I just discussed, and I'll walk through the elements and how to interpret them here. Next slide, please. First, at the top of each page, we include a basic demographic information, the number of veterans in the state, how much of the state's adult population they comprise, the percentage who are over age 65, the sex composition, and the percentage who served after 9/11. Next slide, please. Okay, the rest of the plays includes the measures of need or well-being that I just outlined. So for example, we have at the very top the average number of days in the past month that the veteran reported having bad mental health. So in the case of South Dakota, which is the example state we're using here, the average veteran reported 3.4 days of bad mental health in the last month. The little dot, that 3.4, shows the estimates for the state. Any sort of estimate that you create from survey data or any sort of sample data in general has some sort of uncertainty due to noise in the data. So to quantify that, we have these lines. These are called confidence intervals, extending from the left to the right of that little point symmetrically. In essence, this is the range of plausible values that we can take. So I think there were about 2,700 veterans in South Dakota that this 3.4 days number came from. That's the sample size we were using. It's about 2,700 veterans in South Dakota. And so if we took hypothetically 100 more 2,700 person samples, we'd expect about 95% of those samples, 95% of those calculations to lie somewhere along that line. So that's why we're calling this like a set of these are like kind of the boundaries of uncertainty, the levels of plausibility that we think are like what is a decent estimate of the range of possible mental health outcomes in South Dakota for veterans. At the midpoint of that graph, that 4.5 is the national average, so that there's a sense of the state-specific level of need, need or well-being relative to the national veterans population as a whole. Estimates that indicate higher than average need or lower than average well-being are going to be the right-hand side of that midpoint. Estimates that suggest lower need or better well-being are going to be on the left. Next slide, please. Where the state ranks compared to others is also over on that right-hand column. Next slide. We shade the top 10 states, or including the district as a state, as the highest well-being, lowest need on a measure with blue, and the bottom 10 as the lowest well-being or highest need in red. Next slide, please. Okay. We would love if there were no limitations to this tool, but that's never the case. So essentially, all of these limitations that I have are downstream from the fact that we need each state to have a large enough sample size on each measure. So roughly speaking, we were looking for at least 1,000 veterans, though that wasn't a hard and fast rule, to be able to like come up with a statistic for that on each measure. And consequently, we omitted U.S. territories. We also did not include demographic breakdowns that might be useful, like by age or by sex. We have large enough samples to do that for some of the larger states, but we were looking for a uniform set of measures that we could provide for all states and for the District of Columbia. The data we used were the most recently available at the time of the analysis, but things might have shifted since it was collected. Combining 3 years of birth is also blending different years' estimates. That said, we suspect that these measures of well-being and need do not dramatically change year to year, so these should still be useful. One constraint we have that we were limited to measures included in sources that were publicly available and that have both state identifiable and veteran status identifiable. That isn't always the case with many like large and potentially useful public information sources. So for example, some that you yourself, if you are interested in data and are looking to work with, depending on your state, you might be able to go into the current population survey or the National Survey of Drug Use and Mental Health, the National Health Interview Study. These are just some like major examples of places that you could go and you could find state level data, individual level data on states, veterans. But like some of those data you won't be able to find the state. Some of those data you will be able to find the state, but not every state will have enough where you could feel good about reporting an average and a confidence interval for them. So we didn't pursue those types of data sources, which like left us with ACS, BRFIS, and the VA and the data sources produced by the VA. Right. And then finally, I'll point out that there's some interpretive ambiguity for one of our measures in particular, which this kind of actually only became apparent as after we were publishing this report. So using this best to worst template makes kind of obvious sense for almost all of our metrics. We can probably all agree more binge drinking is a bad thing. VA service disconnected disability rating is a case where best to worst language should be taken with kind of caution. Our framing of it on these data sheets is that more veterans with a service disconnected disability rating indicates higher need. Another possible interpretation that we can't really disambiguate in what we're doing right here. Another possibility is that it could indicate that the state is doing a good job connecting veterans to services. So just that ambiguity in that interpretation of that one particular statistic is something to keep in mind. Next slide, please. So this report was planned as a one-off, but we hope in the future there will be opportunities to repeat it and expand on its accessibility as a tool. First and foremost, regular updates would allow state and local decision makers to stay up to date on their veterans' needs. Moreover, this would allow them to track changes over time, potentially reflecting the efficacy of new interventions undertaken to improve their veterans' well-being. Ideally, we would make this an online tool to explore, to allow for further exploration of the data. We limited ourselves here to the number of measures we could legibly fit onto one page, one printed page. We do have a few more on a spreadsheet that's on our website with the report. Um, but the data sources we used are very rich, and there are a lot of measures we could have included that we did not. Finally, holistic indices that combine information from multiple measures in a domain would be useful summaries of the vast number of possible measures one could potentially look at. For example, we could imagine an overall substance abuse measure combining information on tobacco, alcohol, and other substances from the CDC's BERFIS survey, or a physical disability measure that combines information on specific impairments that both BERFIS and the American Community Survey collect. But analyzing what measures it makes sense statistically to combine is an undertaking all of its own that kind of spread beyond our narrow remit right here. Next slide, please. Okay. Finally, this is a QR code again, if you would like to access the report right on your screen. Complementing this work, RAND's researchers are always available to assist with identifying and understanding veteran-related data. I'll also make a point here of promoting our Veterans Data Hub. If you feel like search RAND Veterans Data Hub on Google or your favorite search engine, which includes documents that provide really efficient how-tos of how to use veterans-related measures in publicly accessible data sources like the American Community Survey. They have the ACS up there as well as the current population survey. Yeah, and with that, I think I'm done.
All right.
Thank you.
Thank you, Dr. Murphy. And what I'd like to say for folks that are here and some that joined a little bit after the start of the hour, feel free to use that question and answer pod that you see at the base of your screen, the Zoom screen. There are a couple questions there for you, Dr. Murphy. Um, just to address one related to the definition of veteran, which is an important question when you're talking about multiple data sources, and then also questions related to the starters research. Um, so Dr. Murphy will dive into those, but we will have time at the end as well to address any questions or thoughts that folks may have from both presentations here. So once again, thanks again, Dr. Murphy. So an important aspect of this is helping us work through how this state level data can provide a more clear picture of veterans' needs and well-being. But it also raises another question: how do we actually find, interpret, and use responsibly this data? And so we have our next presenter. Next slide, please. Dr. Claire O'Hanlon here to help us think a little bit through this particular topic. As stated at the top of the webinar, Dr. O'Hanlon is a policy researcher at RAND, also a professor of policy analysis at the RAND School of Public Policy. She's a health services and policy researcher with expertise in qualitative, quantitative, and mixed methods research. Her work has been cited in outlets such as the New York Times, Washington Post, The Hill, as well as featured in congressional testimony and military policy publications. Prior to joining RAND, Dr. O'Hanlon served as a health science specialist with the Greater Los Angeles VA healthcare system. So at this point, I will turn it over to you, Dr. O'Hanlon.
Awesome. Thank you. Next slide. Great. Thanks for that kind introduction. Really got the top line points of perhaps why you might want to listen to me talk about veterans data. I was in the VA. And this work that I'm going to talk about today is based on a report that came out about a year and a half ago that was motivated by us trying to just understand the landscape for data out there about veterans. This was work that was conducted as part of Veterans Policy Research Collaborative, which is a group of veterans policy researchers from around the country who collaborated on this report with me. So this was also funded by the Heinz Endowment. So I wanted to acknowledge the support of our funder. So next slide, please. This report is based on a pretty simple premise that making evidence-based policy decisions requires you to have an evidence base, and organizations that provide services, programs, try to understand those services and benefits, things like that, things that you're probably trying to do, need access to current and relevant and accurate data sources. I think a lot of people are like, oh, well, the VA probably has all this stuff. And they have a lot of data, but if you're not inside the VA, it's pretty hard to get access to. And it only covers VA enrolled beneficiaries, which is over half of veterans probably, but not a lot over half. So that's like half of the veteran population nearly that is left out of a lot of these major data sources. Next slide, please. So in this project, we set out to understand the landscape of veteran data and to try to create a practical guide for stakeholders to navigate some of these data sources. We did two main activities to do this. We looked at how veteran is defined and captured by agencies and organizations. So I was excited to see this question in the Q&A section about definitions of veteran. I'm definitely going to get into that. And then the second one was we did focus groups with key stakeholders about what data sources they use and challenges they have with those data sources. We talked to veteran surfing nonprofit staff. We talked to journalists who cover veterans issues. We talked to congressional staffers in the both Senate and House Veterans Committees, as well as a group of academic and applied researchers that focus on this. So a combination of the focus groups and some environmental scans, so like literature review, looking at different websites, things like that, led us to the report that I'm going to share with you today. So it's also in the chat there. So next slide, please. So I'm going to talk about veteran status and identity and how it's defined and operationalized. Might seem straightforward, but as this question in the chat reveals, like it's not really consistent, depending on who's collecting the data and for what purposes. And these can often have real consequences. Next slide, please. So the terms I'm going to use here are the terms that we use in the report. I don't think that these are necessarily like terms of art and like consistently used, but this is how we tried to disambiguate the different concepts. The first one is veteran status. And so this is like a yes/no judgment of, is someone a veteran within a certain context? So there's an administrative VA data, they might have a certain definition of veteran versus a nonprofit or research survey might rely on like a self-identification. And those may not always be the same. We also talk in this report a lot about military-specific demographics. So this is really the deep dive into some of the important things you'd want to know about a veteran that would define like what their level of need might be, what other aspects of their military experience impact their needs as a veteran. And then lastly, veteran identity. So this is kind of a squishy concept, but we use it to try to combine both the military-specific demographics and general demographics that can interact to form someone's veteran experience. So next slide. So for veterans, things like military demographic space, like the length of service, the branch, rank, discharge status, reserve status, the era that they served in, their combat experiences, if they had any, toxic or traumatic exposures, service-connected conditions, disability, all of these things really can have implications for the types of benefits and services and needs that people have. But sometimes those can interact also with demographics like sex, age, race, employment, education, etc. So this is just an important thing. So for example, a woman veteran who's experienced military sexual trauma, homeless veterans, a retired high-ranking general. These are all people with like different needs and different benefits available to them. Next slide, please. I don't want to get into this in a lot of depth because we do get into it in the report. And so if you're interested in how a lot of different sources ask the question about what someone's a veteran, how they define veteran status, we go through these in the report in detail so you can kind of see some of the nuances of those. But just briefly, like federal statutes and subgroups defined by federal statutes can sometimes even differ from other government sources at the state and territory level. Surveys that are put out, like the ones that James was describing in the ACS, BRFIS, things like that, those have sometimes different definitions than national veterans surveys that are done for research purposes or by various nonprofits. And those can be different from colloquial terms thrown around or how people self-identify, etc. Next slide, please. And so I just wanted to call out some of the key nuances here so you can see how these kind of play out. These are things that came up in various focus groups or interviews or other interactions we had. One thing that comes up over and over again is National Guard. Like under the federal statutory definition, the National Guard are not necessarily considered veterans unless they have been federalized for a certain amount of time. But because they're under the control of states, often state level definitions of veterans do include National Guard members in those. Another area is like currently serving versus previously served. A lot of big social surveys ask the question as like, have you ever served? And this is going to pick up both active duty and veterans, and also people who may have been once active duty, but then have gone into reserves. There's a bunch of people sometimes struggle to answer this question. And so if you're asking it, just be careful about that if you're trying to target one of those groups over any other. Another area that comes up is discharge status. A lot of people think that it's a binary of discharge, but there's a lot of things that can be considered an other than honorable discharge, and that has serious implications for the benefits eligibility you might be able to get. So, but people might still self-identify as a veteran even if they're not eligible for benefits. Another one that has come up is on some surveys, there will be a question about your connection to military or veterans, and it will be a check one sort of situation. And it'll include both, are you a veteran or are you a spouse of a veteran? And a lot of women veterans are both. And so when they come across these sorts of questions, it's kind of turns them off because they're being asked to choose between their identity as a veteran themselves and their identity as supporting a veteran spouse. Another one that's come up recently, there are new branches in the military, and there aren't a lot of Space Force veterans yet, but there are some. So some surveys just have not been updated yet to include Space Force as one of the branches. So that's something that we're starting to see a little bit more. Next slide, please. All right. So I'm going to get into the meat of today's presentation, which are some of the sources of veteran data that are out there. As a researcher, I was familiar with some of these when we went in, but some of them really surprised me. So I thought that they might be useful to people who are looking for different veterans policy data sources. I just want to caveat that data in this report and in this presentation are defined very broadly. Like I, as a researcher, kind of have like a pretty strict definition of like an Excel spreadsheet with a bunch of numbers in it that were generated by some administrative or survey process. And like, that's what I think of as data. But the people that we talk to, these different veterans policy stakeholders, they conceptualize it a lot more broadly than that. And you probably do too. So this could include data, in a spreadsheet, but it could also include like an infographic that, like the report that that James just presented on, like that's in many ways veteran data. It's just been processed already, so you can actually easily understand it. But that's like an important data source, like these published sort of reports. Or just like top line numbers, things that you'd want to know about, like, how much are we spending on this? Like that is data itself as well. Next slide, please. So one of the major sources we talked to all these different stakeholder groups about was just like administrative data from federal or state government, reports, especially budget documents were a big one. And these tend to have information on like big programs, operations, finances, performance metrics. Um, all the different users we talked to reported using something like this, and they talked about how like detailed, comprehensive, authoritative these sources were, but also how difficult they often are to use without specialized knowledge and frankly a lot of time, as it just takes time to analyze these big data sources or just sort through them if it's like several hundred pages of a document where something's buried in it. Next slide, please. Another one that people talked about with being really important are these real-time sort of online dashboards. The VA is actually pretty good about putting out a lot of these. There's things like wait times. There's the PACT Act dashboard, which shows you how many claims have been processed, things like that. And they're often updated like to be pretty up to date. Journalists and congressional staffers said they were the primary users of these because they were focused on getting stuff that was like current rather than trying to understand long-term trends or things like that. And they're pretty easy to use, like they're pretty straightforward. The main issues that people talked about with these is historical information is not generally there. So if you want to have it, you have to track it. They can be hard to interpret because there's not like detailed methodological or definitional specifications a lot of times. And people just kind of have a hard time interpreting them a lot of times. So it can be a little bit of a limitation. The VA data portal often has a couple, well, they'll post things through that, but they also include things like on the last slide, these like big reports, administrative data as well. So the VA data portal covers a few different areas. Just wanted to note that. Next slide, please. So Freedom of Information Act requests. You guys are probably familiar with the idea of doing this, but may not have done it yourself. This is a formal request that you make to the federal government to obtain information that is not publicly available. So this could be communications between employees, underlying data behind data that might be published in a dashboard, things like that. Journalists are really the ones that were the big pushers of this method of getting data because agencies are generally required to comply as long as you're not looking for like protected health information or other things that have limitations for you to get out. It can be a very powerful thing. Sometimes they're overwhelmed with requests, so it can take a while. And then the things they send back are not always the easiest things to work with. And other users have been somewhat reluctant to adopt this method, I think, because it's perceived to be antagonistic towards the federal government. But I have to say, I recently used this method to obtain some data that we were having trouble getting any other way. And we'd requested it from someone inside the VA, just outside of a FOIA process, and they told us just go through the FOIA process. It'll be way easier for everyone involved. And so we did, and we had what we needed within a month. It was actually like much easier than I expected it to be. So this was pretty promising. Next slide, please. This was something I wasn't particularly familiar with prior to this project, request for information. An RFI is essentially a FOIA request that can be only made by a legislator. So the congressional staffers were the big proponents of this method to get what they needed to try to support their members in understanding veteran program and benefits. So like FOIA, their agencies like do have to comply to this, and they have similar problems to FOIA in terms of like sometimes it take a while if they're overwhelmed with requests. And this isn't available to everyone. Like you have to be a legislator to be able to do this, but it's a powerful tool that if you're working with a legislator on something that you could suggest to them as something they could do to get the information that you need for whatever purposes. So next slide, please. Okay, next one's federal survey. So Thank goodness, Dr. Murphy spent the previous presentation talking about the ways that some of these federal surveys can be used to understand things at the state level around veteran populations and needs and services, things like that. The examples of this, like people were, very positive about using these sources. Everyone said that they were using it in some way. The advantage is that they're often publicly accessible. They have a representative sampling frame, so you can be confident that it is, pretty representative of veterans as a whole. But there's a really steep learning curve to them. They're not easy to use unless you've got some specialized training and a lot of time to do it. As James showed, like it's often hard to get specific subgroups from that because the sample sizes just aren't big enough. So if you're trying to zoom in on like a particular demographic group or a particular age or era, it's just not enough. And then another big one is just like there's a time lag between the collection and release of these data. It's just a lot of data processing. So by the time they come out, they're often like a couple years old, which is not current enough depending on what your purposes are, but could be just fine. Next slide, please. Another one, so are these community partner analyses and nonprofit surveys. So a couple of the veteran-serving nonprofits do their own big surveys. And these are great because they can often get into specific issues, specific subpopulations, things where these big surveys just don't have enough detail to be able to get into. So these are things like the Student Veterans of America Census, Boost Our Families Annual Military Lifestyle Survey. Many users like relied on these, and they can provide a lot of detailed information, but they do have not necessarily representative sampling. So they have a limitation methodologically, like you can't be totally sure that they're representing the full population of veterans. And often I find the methodological documentation on these surveys to be hard for me to find the information that I'm fully looking for from them. There's like not as much documentation as there would be on like a big federal survey. And then the last thing, next slide, is like kind of, the process data. So reports, infographics, peer-reviewed research, things that are like, people have dug through the data to try to analyze and make meaning out of it. So like this state level reports that we just heard about. There's a bunch of different organizations that put these out, including RAND. We have our Veterans Data in Focus series. Military Family Research Institute also puts out stuff like this. There's a few others. And lots of people really liked these because they're short, they're really helpful because they try to focus on issues that are in the current debate in the news. One of the issues that people did talk about this was that research is often behind paywalls. And I just want to tell you that if you ever run into this issue of a report you want to see or a paper you want to read is behind a paywall, just find an email address for one of the authors, bought through whatever means you can, and email them. They will almost always like get it and email you back. That is like something that happens a lot. So just like give it a try. You've got nothing to lose if you're striking into a paywall. All right, next, I want to talk a little bit on the next slide about some of the challenges that people identified. And we got into this a little bit with these data sources, but broadly, some of the things that came up over and over again. Next slide, please. People were mostly, biggest thing that came up is just like lack of availability of some of the data out there. And this came up a lot with some of these dashboards that the VA puts out. People talked about how, you have to FOIA to get the information behind the information that's being put out there. Because like they're putting stuff out there, but it kind of raises more questions than it does answers. Next slide, please. Next one is lack of timeliness. So a lot of the like most comprehensive data sources are like often outdated by the time they're released, like within a couple of years. And that makes it hard to use those to respond to current needs. In some ways, it's an intractable problem, but I think there is probably opportunity for better timeliness. And so people talked about how a lot of the data that they might get out of the VA is just not current, so they rely on other sources to try to work around this. Next slide, please. Another issue that comes up over and over again is just difficulties finding and analyzing data that's there. So people talked a lot about just even file types. So, you look for information on the VA budget, and then you get this, PDF that's hundreds of pages on a government website. So often the information exists, but it's not in a place where you can search it or find it or really use it in an easy way. Next slide, please. Another one is interpretation. So, for example, the term veteran and how we've defined it has changed over time. For a long time, even though women were serving in the military, they were not considered veterans until 50 or 60 years ago. So there's always some error around, like, if you're not exactly sure how veteran status was defined, you may be misclassifying things. So it's an example of people having a difficulty interpreting what they're seeing. Next slide, please. Difficulties accessing historical data have been definitely a problem, especially with some of these different dashboards. So one of the focus group participants we talked to talked about how during the COVID pandemic, there was a COVID numbers dashboard, but it was just erased and re-updated every day. And so he said for a couple years, he had like an alarm on his phone that would remind him to go like cut and paste what was on the dashboard into a spreadsheet every day. And that's how he had historical trends from this. So that was an interesting workaround for some of the lack of the historical data being there. Next slide, please. Again, like usability is a big issue. This was actually what motivated us to FOIA for some of the information this is for like community care data, because the information is on the website, but you can't actually download it. You can just put in like your zip code and query for community care providers in that area. So they clearly had a database somewhere with this information, but it was impossible for us to actually use it. So there's just some, interoperability, usability concerns that I think could be potentially allayed. Next slide, please. And lastly, people really had a high desire for better linkability. I think this comes up a lot with, the transition between military active duty and veteran status across different benefits and services. People were really looking for better protocols around data sharing. Next slide, please. Lastly, I just want to talk a little bit about some of the recommendations we had from this. They're pretty broad, but could potentially improve the environment for veteran data. Next slide, please. So the first one is adopting consensus standards. So over the last few years, there have been different groups that have come together to try to make it consistent how we collect information on sexual orientation and gender identity or race and ethnicity. And I think we could do this for veteran status and military specific demographics as well. And this would just make it easier for people that are trying to create new surveys or other sorts of data information to have an easy source to go to and say like, okay, most people agree that these are like the data elements that we can be using for this. Another one is, next slide, please, is to try to improve the ability of the federal government to enable agencies to link things across different agencies, try to improve service delivery and lack of duplicate services. So this could be things like between the VA and CMS or other areas where there probably benefits from linkages. And lastly, next slide, please. There are definitely some opportunities to improve transparency and timeliness. I think there's like often fits and starts with especially federal veterans data. where there's like a push to try to get things out there in a timely way and transparently. And then 3 years later, there was just that one release, and you're like, okay, well, it's been helpful to also have this every year so we could look at the trends here, but it's kind of in fits and starts. So it would be advantageous to have that more consistency and transparency and timeliness. Next slide, please. So that's everything I have. This report is available at the QR code here, or the link is also in the chat. My co-authors and I, Kayla, Michael, Mariah, Heather, and Rosie, really hope you find this useful. There's a bunch of interesting information about like the different questions that people use to try to identify veterans and some of the different sources that might be helpful to you as you're trying to plan and implement and evaluate different programs and services. So I hope that you check it out. If you have questions, feel free to email me. My email is at the bottom here. And again, we'd like to thank the Heinz Endowments for sponsoring this research. Thank you.
All right. Thank you so much, Dr. O'Hanlon. And also thank you, Dr. Murphy, for both of your presentations. Definitely complementary to one another as one led into the other. Now we do have the opportunity for folks to ask questions as necessary. You can do it through Q&A. Also, folks can use the raise hand function if you'd like, and I believe you can be unmuted so that you can, if you need to verbally ask your question, you can do so as well. One question that I do see currently in the Q&A pod, and I'll just say it out loud and feel free to respond as necessary to both of our presenters. One attendee asked, stated, I work in the DVSA field, and a common question that comes up is service members' spouse needing services or spouses. Are demographics collected to assist in if, when, and how services are provided to dependents?
I guess I'm not exactly sure for what purposes spouse sort of questions are used. I've seen them on a couple of different surveys, mostly put out by like veteran service organizations, because sometimes they serve both veterans and family members of veterans. So they're trying to figure out who is who. I haven't seen this for I guess needs assessment in like domestic violence sort of spaces. So I can't exactly speak to exactly why this question might come up, but I think the point I was mostly trying to make is that often people do fall into multiple categories, and so it's important to make sure that people can fully express the categories they feel they fall into. Thanks.
Thank you. Just pausing for any. Okay. So I do have a question while folks kind of collect their thoughts. So we talked about different data sources, federal surveys, you have some administrative data, nonprofit surveys, dashboards. And so my question is kind of related to for folks that are planning at the state community level, which types of data seem to be most practical and accessible for folks that are developing plans and looking to use whichever data they can get their hands on best? Which types of data from this kind of wide ocean of data sources are most accessible and practical in that type of context?
I think that I mean, it all comes down to like what your purpose is. Is it to try to understand like what the population that you could potentially serve is? Is to figure out like where there are gaps in needed services versus what's already there and available. I think that the stuff that James is going through with his presentation, I think is really, really valuable because it has that you are more confident in the representativeness of it versus something that may have just been like a convenience of like, whoever's on the mailing list of an organization filling out a survey where that might just be like really skewed of people with, needs that they know about because and that's why they're connected to this organization. But on the other hand, if you're trying to serve your population, like maybe a survey of those people is all you need to do because those are the people that are likely to use the services that you're providing anyway. So I don't think there's no like best or worst way to do any of this. It's just kind of like, what's gonna be able to allow you to do the thing that you need to do. And sometimes that representativeness is really important, like for trying to understand overall needs and gaps. And sometimes it's less important if you're trying to like dig down into like, okay, well, here's my population, like what do they need? And like I'm gonna ignore maybe some other people I can't reach as well.
It's also just like to bear in mind how much is it going to cost to collect the data yourself versus like both in time and money. It's like it can sound really like it can sound really easy, like I'm going to go out and survey X number of people who are veterans or whatever, but it gets really hard very, very quickly. And so it's just like some of this data is already sitting there that you can use it, you can access it, at least get a good enough look at the things. It might be better, like your time might be better, like served just using that, even if it is like a year out of date. That's what I'm saying. Yeah.
Yeah. There are like lots of things that are just not they don't fluctuate that much. But then there are also like big policy changes or big global changes. So like, the COVID pandemic really changed like the extent to which people were, receiving certain healthcare services because everything was slowed down. The PACT Act made a huge number of people eligible for benefits that weren't previously eligible. And so like there can be certain, blips that like really can matter year to year, but that like for many things, it's not as important.
Got it.
And also if you need a before and after, like if you like want I mean, if you care about assessing, oh, did COVID affect this, then you want a consistent way of looking at data at the data. So you would want
Mhm.
something that was collected in a similar way before and after. If you don't want to compare, you just want to know what are things like right now, then yeah, maybe going ahead and like not needing to go and like look at the older version is perfectly good or even better.
Got it. Thank you for that.
Mhm.
Um, Looks like we have a couple of folks who want to share their questions. Then we'll go to the ones that are in the Q&A pod. So, Josh, you should be able to share your thoughts.
Hello, my name is Josh Shaver, a retired veteran for 28 years. I served and then retired in 2022. I work in a nonprofit in Austin, Texas. We provide mental health services and all services for veterans and their families free of charge. As a nonprofit, we're grant funded. The question would be based on uh, the emphasis on policy decisions, program design, and suicide prevention, which is a very, very topic near and dear to my heart. What I'm boots on the ground. I'm at federal installations, Fort Hood, Texas. I am at Camp Mabry State Guard installations. We have tabling events about 4 times a week. I'm boots on the ground. So what do I need? The information I need, and I've done IRB request forms for this through the state of Texas, through the coroner's office, vital stats. What I need is non-PII, but I need the number of suicides per zip code. Why do I need that? Because when I set up a table and I energize my community and we set up 20 tables of resources, healthcare, the VA, we can put it all. We don't know where the suicides are happening because that data is not released to us. And I have to do a 18-month IRB request. And at that time, it's still suppressed data, which means 1 through 9, suicides 1 through 9 are not given to me. Only double-digit suicides and above are issued to me. So as far as suicide prevention policy and programs, boots on the ground, people that don't sit behind a computer all day, no offense to anybody that does, but people that don't use analytical data to do their daily routines, I need that data. I need suicides per zip code so that I can put my resource fares in those zip codes with a little bit of analytical, you know, prowess, not predicting the future, but trying to look at patterns and trends. Another thing that, as 28 years in the Army taught me, is that those veterans that have done time in the military and then receive punitive action, so non-judicial punishment or civilian judicial punishment, those are a high-risk population. So that's the other information I need. So this is really a call for support and help for the folks on this website and on this call. I'm sorry, on this call, that I need that data. For us that are on the ground, we need to know, one, the population that has endured 15-6 investigations, justice-involved veterans while they're in service, because those 90% of the time in studies, peer-reviewed articles, 90% of the suicides are connected to justice involved, whether they were civilian or military justice. So we need that. And if anybody has that connection or has that ability, that's where the rubber meets the road. And I can send our mental health counselors, our peer counselors, our resource folks. So any help you can provide is great, but I need by zip code, because I'm in Travis County, I'm in Austin, Texas. There are over 100 zip codes in Austin, Travis County. So without the zip codes, it really doesn't help me put a resource fair and veteran resources and family resources, because we provide free resources for family and children. It doesn't help me unless I can really pinpoint by zip code. I appreciate your time. Thank you.
Thank you, Josh. So I'll ask either of the presenters if you want to address that, getting suicide death data at that level, at the zip code level. And after you respond, I'll move on to some other questions. Thank you, Josh.
I could say a thing or two. Do you have anything to say about it, Claire or Ford?
Why don't you go first and I'll see if I have anything to
Yeah,
add.
I mean the big reason, I mean that's not on our control, of course. It's just like, well, one thing is like the big concern, the reason that that stuff is suppressed is because of privacy concerns, first and foremost, for lots of people. But I'd also just like say, with lots of these like kind of geographic things, at something as small as the zip code, it can bounce around a lot from year to year. So especially in rural areas where suicide tends to be a particularly high problem, even though, so it's like in an ideal world, in an ideal world, we all have all the data we want, but we also are able to have it in a aggregated at a level at some sort of like way that's not maybe a little bit higher than a zip code. That's like where we can, that's not going to be so bouncy from year to year. It's like where like the suicide rate in a small county can like go a lot when it goes from 0 to 1 or 1 to 2, where it like might not in a large county or a large zip code. That's like just, well, one thing I'd say was like, is to be careful when dealing with geographies, especially small geographies and in rural areas or in suburban areas where like the number of people is relatively small. It's just like these rates can jump around a whole lot from year to year or time to time, and you might like get misled and be looking at last year's problem instead of next year's problem. That's all.
Yeah, I think the only thing I'd add to that is like just caveat, I'm not a suicidologist. I don't know a whole lot about this area. I know that it does suffer from a lot of the things that Jim's talking about in terms of like, it's a rare event and it's hard, it's something that's difficult to have data about in any like really to break it down into subgroups that are useful, or like tell you something about how you might be able to prevent it. But I like the justice involvement, that is such a high correlate. Um, if you email me, Josh, you can cohanlon@rand.org, no apostrophe. I'd be happy to hook you up with someone I know does work with justice involved veterans and see if there's anything that she knows that might be able to get you like a slightly more granular data that maybe we are not aware of. It sounds like you've done a pretty comprehensive job of trying to see what you can get. But I'll see if she has any ideas for you.
Thank you both. I'm going to verbally ask a question that was in the Q&A pod, then I'm going to move over to you, Jennifer Adams. So from Jay, one of the questions was, and this is regarding the veteran serving focus groups. Does the report contain a copy of the instrument used in the veteran service focus groups?
I am I think it does. And if it doesn't, I can send it to you. So you can just I think we use slightly different ones for each of the focus groups. And I honestly, it was so long ago that I wrote this. I'll look it up while we're answering the next question. But I have it. So if you would like it, I'm happy to send it to you. Just email me.
Thank
Yeah,
you.
thank you.
All right, so Jennifer, go ahead and ask your question. Jennifer Adams, sorry. Jennifer, you there? Looks like she may be muted. So while Jennifer's getting audio together, I'm going to move over to Ellen's question, and then we'll come back to you, Trudy. So Ellen asks, is there a best practice in collecting survey data, mail, telephone, in person, social media, etc.?
Yeah, I can speak to this. It kind of depends on what your purpose is. And yeah, I'm a broken record on that. That said, a lot of people think that they can get a representative survey from like using online only. And I am here to tell you that you cannot. That the best, like the most rigorous survey will use a multimodal collection strategy. So you might start off trying to get people on the web, but then people who don't respond to that, you might send out a mailing. People who don't respond to that, you might try to get on the phone and go through that way. That's the way that you really can collect people with different levels of literacy, different access to technology, different willingness to spend their time on things. Because some people are like much happier to click through boxes on the internet, and some people it's too finicky. They'd rather just tell someone the answers and have them do that. Um, that said, it depends on your purpose. Doing surveys that way is incredibly laborious and time consuming and expensive. And so you may be able to get what you need in terms of like, trying to prioritize different potential service offerings. You may be able to get like enough information about that from like a web only survey, but you might also need to recognize that like that's going to skew a younger population than if you did it with a mixed mode or a telephone only or some other kind of response thing. So like if you're doing web only, just know that your population is going to skew younger and more educated than it would if it were people that aren't on their computers all day. Yeah, I don't know, Jim, if you have any thoughts on that.
No, I'll just endorse what you said, Claire.
Yeah.
Thank you. So pros and cons to different approaches. Jennifer, you may just need to unmute.
Hello.
Hi.
Sorry about that. Jennifer Adams. I work for the Pennsylvania Department of Military and Veterans Affairs. I had a question. We had a conference and we had some vendors there, and one was like a huge computer company, and they had a way to collect all this information about veterans across the state by using like gym memberships or like the Home Depot, the veterans bonus thing. What do you think about getting information like that?
I'm not super familiar with this mechanism, and I feel like I have more questions than answers for you about it. I mean, it's certainly creative. I think it's definitely harder than ever to reach people to ask them,
Yeah.
or like because people don't answer their phones anymore and things like that. So I think it's interesting and creative. I don't know like how well it would overlap with the true veteran population, but
Okay.
yeah.
Yeah, because I think they buy like the third party lists, like when they
Mm,
sell your information.
yeah.
we passed on it. I mean, they made it sound really good and that we could get all this information and but it just kind of made me a little bit leery. So I just thought I would ask two professionals what they thought.
I think that the one worry I'd have from using that is people would wonder how you got their information if they have been trying to keep it out of other sources. And I think if you're part
Right.
of like a more official state agency, they might not prefer you go the data broker sort of route. But I don't know. I don't know very much about this, so I can't really speak intelligently to it.
Yeah, I don't want to comment too much about somebody else's product without like knowing about like. So I like, but like Claire said, I think it gives me more questions than I have more questions than answers really from it. Like the beginning with like how do they know the veteran status? Like yeah, yeah, I'd want to think very careful. Yeah, I wouldn't rush into it. Is what I'm saying. I guess.
Okay.
Yeah.
Thank you. Yes, I kind of had the same feeling. I'm like, I don't know how I feel about this. Yeah, you can get a lot of information, but dot dot dot.
Yeah.
So, okay, thank you. So that kind of confirms my feelings on that too. Thank you very much for your input, both of you. I appreciate it.
Yep.
All right. Thank you for that, Jennifer. Let's see, we're gonna go over to, oh, I thought we had Tracy. Looks like something, maybe she bounced off. Oh, there she is. Oh. Anyway, we'll go to our next question until there's Tracy. Tracy,
Can
do
you
you want
hear
to go
me?
ahead and share?
Oh.
Tracy? What? So we'll hold off on Tracy. We'll go to, there's another question in the chat. Do you know if Department of Defense or VA or any other organization keeps a record of SMVF mortality and morbidity data?
I do not know the answer to that question. I have to say. I assume you don't either, Jim. No. I'm not super familiar with exactly what VA tracks internally anymore, and it's honestly kind of hard to find out. But I can try to figure it out.
Thank you for that. Tracy, are you back on?
I am. Can you hear me?
Yes.
Yay. So this is Tracy Palmer from the state of Nevada. And I just wanted to, and I don't, please forgive me, but I don't remember who was asking about the zip codes. We work with the death registry, and we are actually doing a regional report where we're looking in where the high suicide rates are. And that gives us the counties so that we can at least look at zip codes in that respect. So I don't know if that's helpful or not, but I thought I would just kind of put that out there, that we've been able to establish that type of a connection so that we can do even a deeper dive of what social determinants or what's going on in those rural areas.
Any thoughts on that?
What was the name of that registry? I think you cut out for a second on
Oh,
my
sorry.
end. Yeah.
So it's a Nevada Death Registry.
Okay. So state death registry. Okay.
Correct. Yeah. And we work with them closely. And because we're seeing some high rates in rural areas, we're kind of doing a deeper dive, and we're calling it like an ad hoc report. And so we're making sure that what's out in those areas. And so to the point of what the gentleman was talking about with zip codes, he can at least, or potentially an idea, is working directly with your death registry centers, and whether it's separated by counties or whether it's separated into just one big state entity.
Got it. Thank you.
Mm-hmm. Don't know if it's helpful or not, but I thought I heard that and I was thinking, we've been diving in. And that's how we've been able to look even deeper into the actual areas surrounding where the death occurred.
Thank you so much, Tracy.
Mm-hmm.
All right. Looking at another question, a follow-up question to the one about the best approach for surveying. As a follow-up, how do you control for a scientific sample?
So I think that the question is asking, and if this is your question and I'm misinterpreting your question, let me know if I'm misinterpreting it. I think what the question is asking here is like, how do you, get a representative sample for a survey? And I think there's a bunch of different ways that people have done this over time. I'm not exactly sure how the federal surveys are currently doing it. It used to be random digit dialing was one of the main methods where you basically randomly dial phone numbers, and that will, in theory, get you a random sample of individuals. Now, I think the people are using postal service like addresses as like a sampling frame and then picking a random sample of people across different areas and trying to target those individuals for inclusion in the surveys. And there's a few other ways to do it. Jim, you seem like you're nodding. Any other ways that people are doing this that you're aware of?
So the federal surveys, like the best surveys are still address-based sampling, where like you'll take a sample of addresses, start by sending out repeated postcards to them to get them to like basically at this point. And nowadays people are filling out these forms online, so it'll end up being a postcard that somebody will like scan and take them to a website to fill this stuff out. And yeah, so with repeated follow-up. Like I'd say the thing that separates a great survey and a not very good survey is really the amount of follow-up really that people are able and afford to do in terms of collecting people who don't respond to the first time around, because it's really all in that like non-response that is the gap between scientific and non-scientific is really all between like who doesn't respond the first time you ask and what do you do about it when they don't respond that first time. Yeah.
Thank you for that. And just to note, I see a comment in the Q&A saying Pennsylvania has used coroners to get suicide rates, just for those who that may be of some value to. Next question related to data collection. Is there anything that we as service providers outside the VA system can do to improve data collection for these internal systems?
Uh, Great question. I'm trying to figure that question out myself. I think some of this is one of the things I'm trying to do is anything that I've like this data that we have asked for under FOIA. I'm trying to get the VA to just like post that on the data portal so that other people can use it as well. It's like not that big. It's like it's pretty useful, or to like consistently query that data and release it every year. There has been a push to put more stuff on the data portal. It's just not being put up there very consistently. And so I think one of the things that we can do is just like ask for the data, or, and push and say like, this is important for us to have, and important for us to have the historical data for. There have been a few people also that have, within the VA that have, created data sets out of the VA, like healthcare administrative data. So for example, a few years ago, some people queried a bunch of data on wait times for appointments. And they had a few years of data and they posted it like on a server online so people could even analyze it. So trying to encourage people to in a somewhat ad hoc way, the things that they're creating make them usable by other people. I think that's a push that people want. So like the person who asked for like the instrument before, if there's someone that like used a data set that you are interested in, you can try to email them and see if they will send you like a redacted version or some other thing like that. People I think are more friendly to doing that, and scientific journals and publications are pushing for more of this data transparency. So I think that's something that we can all advocate for.
And if you pursue the FOIA route that Claire talked about, as somebody who did FOIA research in a totally different research domain, not related to veterans at all, seeing what a successful FOIA request looks like is an incredible boon. Like, it's like, so if you do go down a FOIA, like, so one is like, if you do get data, post it, and to the extent that the law allows, law and ethics allow. And two, that includes like how you got the data. Like, if it is a FOIA request, what did you say? What was the letter like? What did it, like everything, so that someone can take that and pass it forward for their own local health authority or whatever.
Thank you for that. I think we have time for a couple more questions. Another one we have is, have you had any experience with automated integration of VA status from VA databases to other systems like syndromic surveillance systems or violent death reporting systems?
I
I have
have
not.
zero experience with this, unfortunately. Mostly I don't use the I'm not primarily looking at suicide or mental health in my VA research, so I haven't used any of these other sorts of death reporting or other systems like this, so I cannot speak to that, unfortunately.
I've used VRDS, but I have not used it for veterans research, so I can't speak to like how the integration is. So yeah.
All right. So looks like we have a lot of information sharing as well in the Q&A, so I appreciate all those who are sharing information about how systems work across your states or communities, respectively. I do appreciate that information sharing overall. Just to reiterate, for folks that are in line, and for some I know are looking for email addresses for today's presenters, you will be receiving the slides, and the slide decks do have those email addresses embedded within them. So by all means, if you do have certain questions, as was brought up during the course of discussion, and you needed to share them specifically with the presenters, that contact information is there. I'm going to ask just for both presenters today, any final words before we close out this session? I'll start with you, Dr. Murphy, because you presented first.
Nothing that comes to mind. I just want to thank everybody for their time and attention.
All right, thank you. And Dr. O'Hanlon?
No, but I hope that you check out the report, and particularly the appendices, where we try to pull in a lot of the different questions that are asked in the different surveys about veteran status, or point you to some different data sources. I think it's a good primer for someone that's just trying to figure out what's out there and figure out if there's any sources that they haven't come across that they might find useful for their purposes. It's not totally comprehensive. There are definitely things that are out there that are not in there, but we try to provide like a pretty easy first level user landscape for it.
Thank you so much. And Linda, if you're still the next slide. So once again, I do want to thank both of our presenters today for sharing valuable information, and also for addressing some of those questions that folks had from the attendee group. Again, this is one part of a 6-part series broadly focused on advancing data policy and prevention for SMVF. So if you haven't already, and I would assume most folks have registered for that series, feel free to scan this code. This code will also be in that slide deck that will be shared, so you can register at any point. But keep an eye out for additional information from the SMVF TA Center for future webinars as well. Next slide. And lastly, feel free to register for topics in the news if you want to get information that's a little broader than just this webinar series, but additional information that may be relevant to the work that you're doing in your respective states, territories, counties, and cities. We do appreciate everyone taking the time today to both collect information, gather information, and share amongst one another. And we look forward to joining you at the next webinar. So that's all we have for today. Once again, thanks to our presenters, and thank you all for taking the time. Have a good afternoon.